Sam McComas, I appreciate you being here with me today. Can you walk me through a little bit of how has the latest coronavirus surge in Idaho impacted the VA in Spokane?
Yeah, there's been a lot. Of course, our facility is only about 20 to 30 minutes from the state line, and just a little further to Kootenai Medical Center, which is just across the border in Coeur d'Alene, Idaho. And that covers our catchment area, or our catchment area is included in that. And we have been in close collaboration with Kootenai Medical Center specifically about what we can do to help them assist care for patients, both veteran and non-veteran patients alike. And that has included, we have been able to admit patients from Kootenai Medical Center and transfer them to our facility. And some of those are veteran patients and some of those are non-veteran patients. However, when we come from the VA, we call it our fourth mission or our humanitarian mission. We see a need in the community and we want to do what we can to help out. And any patient that we can admit to our hospital here in Spokane opens up a bed for Kootenai Medical Center to have more capacity to care for a patient in their facility. So we feel like it's a community effort and we're happy to be part of that effort.
The pandemic has put an unusual strain on all healthcare facilities. How unprecedented is it for a VA medical center to accept civilian patients?
Yeah, this is a unique circumstance. This is something we did during the COVID pandemic when it sort of during the first peak, and it's something we're doing now. I know that other VA medical centers are in collaboration with their community partners, but it is sort of the first time during this COVID pandemic. It's the first time that we've actually done it. We've talked about it, we've made communication, and we've made partnerships with our community partners and the hospital community partners. But this is the first time we've done it, and we feel like it's a great honor. It's a great opportunity. You know, some of the data, if I can just take a second to share, you know, up until this point, during the last couple of weeks, about 3 weeks or so, we have admitted a total of 8 patients from Kootenai Medical Center. 2 of those were non-VA patients, and 6 of those were veteran patients. One of the daughters of one of those humanitarian patients that we admitted, her mother was admitted here, and we cared for her here for a few weeks. Upon triage and evaluation in the emergency room, her mother was preliminarily told, we may not be able to admit you, even though you may or may not meet criteria for admission, just because we're so tight. And then we were able, in collaboration with our partners at Kootenai, to offer that patient admission here. And the daughter reports how thankful she was that we were able to offer admission to that patient here. And she was very complimentary to the care we were able to provide here. She is also a healthcare professional, the daughter is, and we were able to get some information from her specifically about the top level care that her mother was able to receive here. And we feel like that's one example of the great work we can do as community partners together with our partners in Idaho.
Your medical center is about 30 miles away from Kootenai Health, but I wanted to run by you. Has the VA been accepting any Washington COVID patients, or is it mostly Idaho COVID patients that you see?
Yeah, of course, it's a combination. Specifically, we have an urgent care center here. We have all of our regular admissions that we see here. We have seen an overall increase in demand from both Washington, Idaho, Montana, all of these areas. There is an increase in demand. One of the other partners that we've partnered up with here in Washington is our state veteran home. So this is not a VA entity, it's the Washington State Department of Veteran Affairs. They have a long-term care facility here in our community, and we've built a great relationship with them. And we have also admitted some of their patients here so they can receive a higher level of care, all of this related to COVID and COVID-like illnesses.
Outside of the pandemic, the VA, of course, offers a variety of services to veterans. Have you had to reduce any services that perhaps would normally be provided to veterans in Washington?
Yeah, great question. So this is a balance this is a fine line that we walk every day. Of course, it comes down to doing what we can to offer the most care we can to as many patients as we possibly can. Some of those outpatient, non-emergent services have been impacted. We have had to divert resources, mostly staff members, to help care for our more acutely ill patients. That means that sometimes that ambulatory outpatient every year sort of annual checkup type appointments. Some of those have had to be delayed or rescheduled. Of course, we're doing everything we can to convert those to virtual appointments whenever possible. We do what we can as a sort of a makeup. We've offered a lot of overtime and extra hours to our staff members to be able to do that work. But still, yes, there are impacts to some of those outpatient services.
Has that resulted in any adverse outcomes for patients who perhaps would have gotten that care had it not been a pandemic?
Yeah, that's a great question. That's something we wrestle with all the time is, well, what if that patient who's waiting has something bad happen to them? So that's why we have done, I'm especially proud of our home telehealth team. This is a team of nurses who contact patients by phone. And we've been especially vigilant with those patients who have tested positive for COVID, but were not admitted. Maybe they were not ill enough, they didn't meet criteria for admission, but we still know that they tested positive for COVID. We have a team of nurses who are reaching out to those patients on a regular basis to see how they're doing. Are your symptoms getting worse? Are you able to get things done that you need to do? Do you have the support you need at home? And that's one of the measures that we are doing because of that very concern. We're doing what we can to reach out to those patients in a proactive way, most of it virtually, just to connect with them to see how things are going.
Earlier you mentioned outreach. What is some of the outreach work that you're trying to do, whether it's education on vaccines or just work with patients in need of care? What kind of outreach has the VA done?
Yeah, we're doing a lot of outreach. So like I talked about, we're doing a lot of outreach that we can virtually. Another thing that we're using is social media. Another opportunity that I think is really exciting is we have continued services via our mobile medical unit. It's basically, think like a large like school bus type mobile clinic that is able to go to some of our rural communities especially. So it's complicated because of course we have an increased COVID risk. So we know it's a small clinic space. The staff there are very diligent, very well qualified, and especially when it comes, for example, to COVID vaccine, in discussing these topics that are sometimes politically charged and emotionally charged. One of the things that we have found benefit in is these staff who work on the mobile medical unit have relationships with these patients, right? These are, oh, I want to go see my nurse, or I want to go see my doc on that mobile medical unit. And when you have that relationship of trust, we feel like that's one of the best opportunities when that medical professional can have that very careful conversation with the patient about what it means to get vaccine, especially if that patient's sort of on the fence. What a great opportunity to be able to have a conversation with someone you trust who can help guide you through that decision-making process. That's one example of the outreach we've been doing.
Earlier we talked about equipment. It's my understanding the VA has shared some equipment with other hospitals. Can you walk me through how those resources have been divided?
Yeah, thanks for the question. So we, early during the first COVID surge, we identified the opportunity where maybe it would be wise for us, for our facility, and also as a community partner, to increase some of our equipment, such as things like ventilators and the equipment that's associated with ventilators. And so one of the things that we've been able to do during this most recent COVID surge is we have lent 4 ventilators to our friends at Kootenai Medical Center, and also 4 additional ventilators to a partner, North Idaho Advanced Care Hospital in the Post Falls area, where we're able to lend that equipment to them. And from our perspective, they can use it on whatever kind of patient they need to. And it's a great opportunity for us to, versus that patient simply, or that ventilator sitting here in storage or sitting here getting maintenance, we can send that ventilator out, and that's another patient who gets to be on a ventilator. It kills us to know that we have colleagues and counterparts who may be in that crisis standard of care where they have to decide, and as an example, there are 2 patients who need a ventilator, but I only have 1 ventilator. We heard that and said, hold on, we can help. So that's one of the ways we're trying to reach out.
Sam McComas, I really appreciate your time today, and I hope you're doing well.
Absolutely, my pleasure. Thank you.